intermediate risk is an interesting space because I think the case could be made to forgo BCG for some of those people. But I know now we also have some new options. And so I want to cover some of these new options. Let's start with intermediate, just because I think it's great to have like a true BCG alternative. Unlike some of the other high-risk emerging drugs, I'm not sure those are alternatives yet. They're more like salvage options. But I think that's what makes me excited about the intermediate space. So tell me about what your thoughts are with some of our new alternatives out there.
Yeah, I totally agree about the intermediate risk patients. Even before the new exciting alternatives came out, and patients who had low-grade intermediate risk disease, at times I preferred using gemcitabine or an intravesical chemotherapy over using BCG, both in a shortage era, but sometimes the efficacy just seemed a little better. But if you could maintain the ability to not give BCG to those patients with low-grade intermediate risk disease, that would be awesome. And so there's kind of intravesical chemo agents. Mitomycin historically was used a lot with really good evidence, but a lot of side effects. And gemcitabine then kind of came out. And I tend to prefer that as intravesical chemo, solitary intravesical chemo. But what has recently been approved that is a little bit more exciting is a mitomycin hydrogel, which seems better tolerated, truthfully, than the intravesical mitomycin that I remember from my residency. And that is based on trials that looked at, an intermediate risk population where mitomycin gel, which is like allows it to dwell a little longer and then break down in the urine and be passed out, is given as an adjuvant strategy. And that really had a great CR, a complete response rate of 79% at 3 months. It's super exciting. It is now approved in that setting. They had another trial looking at it as like a primary chemoablative strategy. It's not quite approved in that setting, but I think that also is something that could be exciting.
Yeah. And I like the idea of saving BCG for when we need it, because let's not forget, for these patients, progression is maybe not as much of a concern as some of our other high-risk patients, but it is still a concern. And so it feels good to still have BCG in our back pocket, because we'll talk about some of these new drugs, but they're pretty expensive. So it's nice to keep that option.
Completely agree. It is nice. And if they convert to high grade, they can get BCG. But if they never become high grade, gemcitabine alone or this new exciting medication in the form of mitomycin hydrogel that gets put in.
Yeah. And tons more activity in the high risk space. Again, I want to cover this, but I want to, kind of put out the caveat that most of these agents are still for patients who have failed BCG. We're not quite ready to replace BCG. And so first, let's go there, actually, before we cover these agents. Tell me, what are your thoughts on that? Because there's a lot of activity happening, and I still, I get really excited, but my hesitation is, well, it's still not a BCG replacement. So, tell me what you're thinking when you hear about some of these new drugs.
Yeah. I think they're all exciting. It's great to have a backup to BCG, but so far, there's trials ongoing comparing things to BCG, but so far everything is for BCG refractory patients, so it isn't approved as frontline. And I think the cost of some of those drugs may prevent it from being approved as frontline if they can't prove that they are superior to BCG. And I think that's kind of on those companies to prove that they are superior to BCG so that they can be used as frontline, in my opinion.
Yeah, no, I think that makes sense. And again, even if they are approved, it's like the patient is going to be carrying some of that financial toxicity, right? So it's like, if we have the option, great, but that still may not be the best next step for some folks.
Absolutely. And there are relatively cheaper options, like chemo-based intravesical therapy is obviously cheaper than some of the new things, but we don't have great prospective data on that.